Hello, my name is Anna Fasano, and I am a nationally certified art therapist at Swedish Cancer Institute, and am also a licensed clinical mental health counselor. I provide individual, family, and group art therapy, both in person and virtually.
And I'm Kim McAndrews, also nationally certified as an art therapist at Swedish Cancer Institute and licensed in clinical mental health counseling. I work virtually, offering individual, family, and group art therapy through telehealth, and I often incorporate mindfulness techniques into each of my art therapy sessions.
So the first question you may be wondering is, what is art therapy? Art therapy is an integrative mental health approach facilitated by master's level clinicians that uses evidence-based interventions to offer mental, emotional, and psychosocial support. Art therapy engages the mind and body in the following ways: kinesthetically, meaning by touching, doing, experiencing, and moving; through our senses, including our perceptions; cognitively, in our ability to think, reason, and remember; and through symbolic forms of self-expression and self-exploration.
Using simple and accessible art supplies and medium, such as brushes, paint, oil pastels, pencils, paper or a journal, collage, scissors, glue. Art therapy harnesses the process and practice of art making as a tool for moving beyond the limitations of language and even accessible consciousness. Combining art making with talk therapy allows us to access parts of the brain that talk alone might not reach. A region where nonverbal content is stored. This area of the brain, in the right back, is the safekeeper of some of our most traumatic memories. If you've ever experienced nonverbal memories, such as the sights and sounds and smells associated with the past, it can be difficult to process these experiences through talk alone because these nonverbal memories are not rooted in language. Art therapy provides gentle ways to access, process, and release nonverbal content by using visual and symbolic methods for cathartic expression. Art therapy holds space for the complex and unique experiences of the individual, empowering them to transform. Through engaging with art therapy, folks may experience a new outlet for emotions, explore feelings that are difficult to put into words, increase self-awareness and self-discovery, reduce stress and anxiety, build positive coping skills, and even increase resiliency.
So, who can benefit from art therapy? Art therapy can be beneficial for anyone. If you are looking to explore new ways to express yourself, are curious about your reactions and responses, are looking for alternative ways to cope with stress, or are wanting to gain new tools for self-soothing and self-regulating, art therapy may be a good fit for you. Absolutely no creative or artistic experience is required to benefit from art therapy. Art therapy is about the process of making art and is not linked to the creation of a finished art piece to be impactful. A little bit about the history and context of art therapy. Art therapy has roots in art education and psychotherapy and incorporates many different schools of thought and theory. The field of art therapy is expanding, and exciting new developments and evidence-based research are constantly being published. The two of us are committed to ensuring that we grow along with the field, constantly and diligently expanding art therapy offerings here at SCI.
There are two main well-known recognized approaches in the field of art therapy. One is art as therapy, which recognizes the art practice in itself as the therapy. Art as therapy believes that making art can be a form of healing, self-regulating, self-soothing, and can minimize stress through nonverbal expression and cathartic release. Then there's art psychotherapy, another approach to art therapy using the art making process as an investigative tool to curiously explore, analyze, extract and construct meaning about one's lived experience. It can also help one clarify goals, explore values, and even experience greater acceptance.
So what is offered and who can participate in art therapy? Art therapy at SCI is completely funded through philanthropy, and all of our services are provided free of charge. Additionally, we provide all participants with an art kit containing supplies needed for art therapy.
This means you don't need to buy a thing.
Individual art therapy sessions are available to anyone in Washington State receiving cancer-related care through Swedish. These sessions can be attended by the individual and accompanied by any family members, partner, or friend, providing a supportive or caregiving role for the individual navigating diagnosis, treatment, and survivorship.
We also offer a weekly art and wellness group meeting via Zoom every Tuesday morning from 10 until 11:30. This group is available to anyone in the state of Washington impacted by a cancer diagnosis, either personally or as a caregiver. And our art and wellness group is available to folks outside the SCI network, so you don't need to be affiliated with or receiving care at Swedish Cancer Institute to be eligible. If you're receiving oncology care outside of Swedish, we simply need to confirm your eligibility prior to attending your first group. How can you get started? If you're interested in any of our art therapy services mentioned, feel free to ask for a referral from your social worker or oncologist, or reach out to SCI Art Therapy directly at 206-215-6178 or 206-309-5437. We will do our best to align you with the services as quickly as possible, but please note that there is sometimes a wait list for individual services.
We look forward to connecting with you.
See you in art therapy.